Vaginal prolapse is actually a really common problem. Arguably, if you live long enough, every woman's going to get a prolapse. It's a question of not whether you're going to get a prolapse, but when. But perhaps more importantly, it's a question of how bad it is. And prolapse is common as you age, but it's not necessarily very symptomatic. One of the things about prolapse is that sometimes people will get told by their doctor that they have a prolapse. In my opinion, a person that doesn't know they've got a prolapse until a doctor tells them they've got a prolapse hasn't got a prolapse. They do have a prolapse because physically you can see the prolapse, but if it's not actually producing a whole lot of symptoms, then it's actually not very important. The important prolapse is the one that's bothering you. But the answer is that it's actually very common. And it's common for a number of different reasons. And first and foremost, because we as a species have evolved badly. And specifically, we decided to walk on two legs, and the muscles that used to hold all our innards, backwards, all the muscles that used to wag our tails are now asked to support all our innards, to control our bladder, our bowel, our vagina, and stretch enough to allow a very large-headed baby go through those tissues and still expect those tissues to function well 10 and 20 and 30 years later. So from an evolutionary perspective, we are at risk of prolapse, but sociologically there's problems as well. There's one of the very important factors is obesity. Obesity contributes to prolapse significantly, and unfortunately obesity is getting increasingly common in our society, which puts ever more pressure on our pelvic floor. There can be medical problems such as chronic constipation and chronic cough which contribute to it. There's a very important familial aspect to it, and so some people have much stronger pelvic floors than others. The horse rider, the ballet dancer and the gymnast usually have very strong pelvic floors. Some people have very weak pelvic floors, and if your mother's got a very weak pelvic floor, then there's a very strong chance that you've inherited weak pelvic floor tissues from your mother. Of all the things that will contribute to prolapse, the one easily reversible factor is to not damage it, and the thing that damages it more than anything else is vaginal delivery. The vaginal delivery has a very difficult, unpredictable effect on the prolapse. You can certainly successfully deliver on multiple occasions and never have a problem with prolapse, and you can certainly never get pregnant and get prolapse, and you can deliver by caesarean section only and still get prolapse. But you are at much greater risk of developing prolapse if you ever deliver vaginally.